Hi, welcome to Nutritional Medicine by Lab Analysis. My name is Dr. Cyrus Thomas. I've been a chiropractic physician for 34 years, and I have degrees from other countries as well. I've been practicing nutrition for 34 years as a chiropractor and do all kinds of blood tests and hair analysis and saliva and stool and urine. We test for everything in the office. We do very comprehensive nutritional programs. I've talked about thyroid problems, liver problems, memory, emotional difficulties on this show. We've also talked about the endocrine system and hormones, male hormones, female hormones. Today we're going to talk about the cost of medicine, because I think it's a reason why a lot of people don't follow through with good nutritional care. It's because they think it's going to be so expensive. One of the big problems, of course, is that insurance is dictating a lot of the way medicine goes today. And so we have to find a way to do nutrition at not such a high cost, because people are having to pay out of the pocket for it. The cost of health. We know that since 1950 to here 2010, the cost of medicine has been a steady rise. We have gone from about 4% of the gross national GDP to 16%. Now that is a fourfold increase, 4 times. Not good. Alternative modalities that people would like to try, but their insurance doesn't cover it for them, are using nutritional medicines that we get to. In other words, we know which medicines to use by blood testing, saliva testing for hormones and allergies, hair analysis for heavy metals and minerals. We use homeopathic remedies as an alternative modality, as well as acupuncture, chiropractic, and herbs. Most of these are not covered by insurance companies, even though once in a while you find an insurance company covering chiropractic and acupuncture. Not long ago, all chiropractic treatment was covered by insurance companies. We won that in all 50 states. However, with the advent of HMOs and PPOs, they circumvented the federal law that came in under Nixon, and no longer were they required to provide a chiropractic or other alternative methods of care. Rarely covered by insurance, and this is a conundrum, a very unsolvable problem. If you must have your health care covered by insurance, you will need to receive pharmaceuticals to treat your symptoms. How many times do we see people that say, no, I'm sorry, I can't come in and see you because my insurance doesn't cover it and I won't be able to do what you recommend? That is a sad state of affairs. Homeopathic medicine has been sanctioned as part of national medicine now in Switzerland. Acupuncture is now becoming more covered by insurance companies. Homeopathic care is also covered in France. And in France, nutritional analysis, nutritional medicines are used by medical doctors much more than they are here. The solution: you can always use insurance for diagnostic testing and then use natural healthy substances to treat, instead of using too many pharmaceuticals, which are man-made molecules that treat symptoms only. We want to use molecules that exist already on the planet without man's chemical intervention, which is what we find in nutrients such as enzymes, amino acids, vitamins, minerals. That's what we find in herbology. These molecules have been not tampered with. They're also not usually synthetically derived, versus pharmaceutical medicines, which are man-made, synthetic. They are patentable because they're one of a kind, and so that makes them controllable, and it also raises the cost. Insurance companies like to use pharmaceuticals and expensive diagnostic procedures because as much as they promote the image that they are trying to save money and that they are not doing well financially, they are doing extremely well, because 16% of the GDP is now for healthcare. See, the greater the percentage of the GDP for healthcare, the more an insurance company makes, the more a hospital makes, the more the pharmaceuticals make. So it's just pure capitalism at work. If we were to go to a Canadian model, a European model, we would be able to have many of these things covered, and you wouldn't have to do pharmaceutical medicines to treat your symptoms to save money. But let's talk about the actual cost of what it costs to get well naturally. I've been helping people find solutions for 34 years. This is what an English kid eats in Britain in 1 year. And a lot of this is junk food, fast fried food, canned food, soda pop, and cereals with sugar. How do we keep a person from having diabetes and cancer by the time they're 60 when they eat like this? It's just not possible. And people who say, well, food doesn't determine how your health is. Well, we heard that coming from the medical profession for 50 years, nutritionists have always said the opposite. Now it's starting to become more accepted. This is what an American eats in 1 year. There's a lot of flour products, a lot of processed foods in cans and packaged food. There are some meats and cheeses. We can lay it out into a graph here. And what we see is that these are the vegetables, coffee, cocoa. These are fruits. These are fats and oils, red meat, poultry, fish, eggs, cheese, and dairy products that are not necessarily cheese. This is white flour, wheat flour, and corn syrup. Right off the bat, we can get rid of wheat flour and corn syrup, and we can take these good saturated fats from animal products and spread them out much wider. We can reduce fruits a bit. The body actually doesn't like fructose very much. It has to convert it all to glucose because it sees fructose as a poison. The vegetables can increase as well, and we can certainly consider some raw cheeses and organic cheeses up here. For fish, we bring in salmon once a week for omega-3s, etc. So when we talk natural care and nutrition, of course, we talk about diet. We use science-based nutrition. Now, that means that we're actually doing a blood test and a urine analysis and perhaps a hair analysis, saliva analysis, stool analysis for parasites. We're getting the big comprehensive picture. And based on that, we then come up with nutritional medicines to prescribe. Science-based nutrition is a group of doctors using nutrients for medicines. They have collected blood, hair, and urine values on thousands of patients and can compare your values to those in the database. This tells you which nutrients work best for your imbalances. Now, this is a fabulous thing that is taking place. It is actually state-of-the-art medicine now, where we've taken the nutrition, the blood, urine, and hair analysis on thousands of people, computerized all of the results, given those people nutrients to take to get well, retested them, looked at how well those nutrients worked to correct their values in their blood and hair and urine, etc. So we know which nutrients are working well. They actually become famous for what they do. The computer then favors them, and we know which nutrients to recommend for the values that are not correct in your own lab findings. It also cross-references. So for example, if we say your liver enzymes were high, this can result from the fact that in your blood, A, B, C, and D were too high, E, F, and G were too low, and in your hair analysis, we found the heavy metals, arsenic, lead, and mercury, which also makes it difficult for the liver to do its functions. Thus, all of that could have contributed to the resultant increase in enzymes in your liver. It's a smart way to do medicine. We're testing 52 elements in the blood. We're color coding those items for how far off from normal they are. And then we do a retest months down the road, and we look at the change in colors. This person did quite well from the right column to the left column. This is a close-up. Yellow is a warning, red is high risk, and blue is critical. We've talked about this on the show before, and we're looking for color changes. Of green star is optimal. And of course, we're looking at liver enzymes, kidney function, all the different cholesterols. We're looking at thyroid function, white blood cells, red blood cells, inflammatory markers. We're looking at cancer markers as well. We like to test for cancer markers, which also tell us about inflammation early in the treatment program. A lot of doctors don't like to do cancer markers because it scares patients. We educate patients to tell them that cancer markers don't always point to cancer. Oftentimes they will just be high with inflammation, and not to be too concerned about that unless we see several markers are high and the patient's general symptomatology points towards the possibility of tumor formation. We're also looking at alkaline phosphatase. We're looking at C-reactive protein, other cancer markers that are in every blood test that's normally done. Anyway, so we correlate all of that information. This is a hair analysis, and we're looking for heavy metals and we're looking for good minerals. We're looking for the balance of all of those substances. We test some 33 substances in a hair analysis. Let's talk about the cost of medicine. Now, these are not my prices. These are the prices in general. And most practitioners are in line with these prices. Federal law dictates that a show like this cannot talk about one's own personal prices, so I'm honoring that. A chiropractic treatment usually runs about $65. It'll cost less if you have a series of adjustments. Chiropractic treatments are about acupuncture treatments rather, are about $65. Homeopathic consultations take a long time. The first visit is 2 hours. That's $250. And then we do monthly 1-hour visits for $150. And that's around the same price as it is to see a psychologist or a psychiatrist these days. This is a picture of a 1-month-long hormone cycle in a female. Samples are taken from the saliva for hormones throughout the month. We mail those in and we get this report back. So if any women are watching and they are having difficulty with how you feel and you suspect that it is hormonal, rather than just get a blood test for hormones, it makes a lot more sense to do a 1-month saliva study and to get the full graph and to know exactly what's going on. We also know which nutrients to give at which time of the month for that. Nutritional consultations, if a person comes in monthly, we talk for an hour each time. Those are $150. And with nutrition, you really need to do multiple visits because you think you know what you're doing, and then the month later when you come back in, you say, oh, I've been doing this, I've been doing that. We want to give you suggestions that would be even better than what you think is great that you're already doing. It takes a few months to actually iron that out. Nutrients can cost about $80 to $200 a month, depending on the intensity with which you want to approach it. Now, these nutrients are actually food substances. They are good for you. So when you're taking a number of nutrients, you're actually eating less food, so your grocery bill goes down, and it helps pay for the nutrients that you're taking. When we test the blood, it's about 250, normally, that blood test I showed you would be $350. We're doing it for $250 because as a group of doctors doing science-based nutrition, we can buy blood tests in bulk and we can pass the savings on to you. A hair analysis is about 105, a urine analysis 20. Report, we combine all that information into the report I was telling you about, where we cross-reference it with the data from many, many other patients to get that report, to send the information to Dayton, Ohio, to a massive computer there, and receive them back and to go over them with you. We charge $150 for that. So the total for the blood test, the hair analysis, the urine analysis, and the report is $490. Now that can also be, the doctors that do this method also set up payment plans so people can pay them over a 3 or 4 month period. Now, if you look at the cost of a monthly visit of $150 and nutrients $80 to $200 and testing of $490, you can get started with a doctor like myself for about $640 for the first consultations and all the testing. The second visit plus nutrients to start the treatment would go from about $230 to $350, depending on how many nutrients you need. So we're talking about $900 to $1,000 to really get firmly established. So if you were to walk into a health food store and you look at all the products that are there and you say, which ones do I need? You ask the person who works there, they say, oh, take a multi, take this, and this one's cheaper and that one. You're going to end up going home with 5 or 6 products that aren't going to really make a whole lot of sense for you. They're going to be products that are produced by companies that are mass producing and competing in price with all the other companies in the store. We use nutrients that are only sold to practitioners and physicians like myself. These nutrients are for extremely high quality. Many of them come from foods that are grown on organic soil with artesian well water. They're very conscientious about how they do things. You actually end up getting the nutrients, the 5 to 10 nutrients that are perfect for you that can correct your situation, because they're based on science. They're based on the lab values that we received. Follow-up monthly visits are $150, and if we do retesting of the blood in the hair and urine in 2 to 6 months later, that runs $390 instead of $490. So there's $100 savings for retesting in order to encourage people to do that. And people with chronic diseases will test 4 to 6 times with us over a 1 to 2 year period. Somebody who just wants to get in a little better shape than they already are and promote longevity, they might test just a couple of times. A nutraceutical is actually an extract of a food with a medicinal effect on human health. The nutraceutical is usually contained in a medicinal format, such as a capsule, tablet, or powder in a prescribed dose. More rigorously, nutraceutical implies that the extract or food is demonstrated to have a physiological benefit or provide protection against a chronic disease. Protection against a chronic disease. How many of you listening right now are taking nutrients to protect yourself from chronic disease? Probably 5% of you. You really need to start thinking about this, especially with the way food is processed today, with all of the toxins that are sprayed on foods and all of the chemicals that are given to animals. This is something we have to pay attention to. And you might be happy to know that Marin County has the longest longevity for men and women of any county in the United States. 86 for women, 81 for men. We also have the least number of cigarette smokers at 7.5%. Our state is 15%. Some states are at 33%. The last 30 years have shown an explosion of nutraceutical knowledge. Nutraceuticals are medicines. They are complex molecules to be respected even more than man-made synthetic molecules that just treat symptoms. What is an enzyme? I'll make it simple. The enzyme is this gray area, these gray things down here. A couple of molecules join onto the enzyme. The enzyme transforms them and changes their color there as the example, and then they can leave as actually different molecules. So enzymes help us take molecules and turn them into other kinds of molecules that are more important and that we need. So we have to have these reactions taking place. Vitamins can act as an enzyme to change a molecule from one to another. Minerals can act as an enzyme. Amino acids can act as an enzyme. A Code of Honor by Van Merkel, a chiropractic physician that I admire. He's been practicing nutrition. He's helped put together this program of science-based nutrition. He said, it is an awesome responsibility when a patient comes to me. I must do my best. I must not be distracted. I will not order one test or recommend one vitamin more than is necessary. But neither shall I shirk from any duty, meaning I will not tell you that, oh, don't worry, you don't have to do this testing. We want to save you money. No, we will say when it's really important to do it, we will tell you that you really should do it. And without health, how can one fulfill their optimum potential or purpose in life? This is my office on D Street in San Rafael, and I have a sort of complicated website address, Integrative Alternative Medicines with an S.info. And with websites, it doesn't matter whether you capitalize or use a small font. So integrativealternativemedicines.info. You'll find many pages there talking about different ailments. You can look it up by ailment. You can look up what the testing is that we recommend. There's articles there on numerous subjects. I would like to thank the Community Media Center of Marin for making this studio possible, for making these shows possible. This show airs every Tuesday at 8 p.m. At night, and hopefully you'll watch. We shoot two new shows a month, and I'd like to thank the crew of this show, especially Brad Flaherty for helping out. Consider why you want to get healthy. It's not only for longevity, but it's to have a better quality of life now. If you find this hard to do because you're craving sugars, white flours, tobaccos, alcohol, marijuana, your cravings can keep you from feeling that you really can do this. One of the reasons why we have cravings is because we're making so many mistakes. One mistake, for example, is that most flours have opioids in them. Opioid chemicals keep us addicted to those flours. If you know this and realize it and begin to eliminate most grains from your life, this addiction to opium eventually goes away. This will help with reducing sugar as well. We get people on organic coffee. There's just so much you can do. And when the right fats are in the bodies, from good butters and coconut oils and olive oil, the body feels nourished and it feels good. So it doesn't have to have that candy bar. It doesn't have to have a milkshake. It can go on and feel better. So that's what a nutritionist can help you do. My phone number, 847-5020 in San Rafael, integrativealternativemedicines.info. Hope you've enjoyed the show. We've talked about a delicate subject, money. It's not always easy to talk about. For people who do not have anywhere near the monies that we talked about tonight, and they are on disability or Medicare, we work with them by saying, how much do you want to spend a month? What can you spend comfortably and not feel bad about it? They give us the figure. We'll do the best that we can do with that figure. You can always do something good and something better for yourself at low cost. If a person can do at least $40 a month, something can be done. If they can do $80 a month, even more can be done. So it works like that. It depends on income, of course, but practitioners like myself will work with you. Thanks for watching our program, and may you be in good health.